Well, if you are having breathing trouble, there is a chance you might need braces, but can you decide which kind to get? Here to tell us more is Mandeep Johal, a functional dentist with the Family Dental Center in Guelph. Good morning.
Good morning. Thank you so much for having me.
I'm so excited to have you here because we were talking, and this is absolutely fascinating to me. I didn't even realize there was different types of braces for breathing issues.
Yeah, so I do want to start off by saying I am a general dentist. That is important to get out there.
Okay.
But yeah, there is a difference. So if you take a look at traditional orthodontics versus airway orthodontics, I think we have a slide about that.
Yeah.
Like the main difference is when we're doing airway orthodontics, we're looking at your sleep.
Okay.
So the main assessment that I do is how are you sleeping? Are you sleeping? Is there any sleep disorder breathing happening? Are your jaws too small? Are they too far back?
Okay.
So we're gonna have slides I'm gonna be showing you that about later. And looking at your posture. So when I take pictures, we're taking whole postural pictures head to toe. I'm not a chiropractor and I get that, but what we do here affects your whole body head to toe.
Absolutely. Your teeth and your mouth are connected to so many other things in your body. Absolutely. Okay, so we talked about traditional versus airway. You also have example which you have done different methods in twins, which were done different methods in twins.
Right. So that was done by the pioneer in airway orthodontics, Dr. John Mew. Many years ago, and I don't know how he got to do this, but he had two-sided twins, and they had, you know, the bucky teeth where the upper teeth stick out.
That's right.
So the upper twin that you see on the screen, he got two teeth pulled out. That's a major difference between traditional and airway orthodontics. We do not pull teeth.
Okay.
So the first poor twin got two teeth pulled out, and if you take a look at his structure at 13 years age, chin is further back.
Yep.
Chin, if you look at his cheeks, also sunken in.
Right.
Imagine the 50-year-old him.
Wow.
And now look at his twin brother who didn't have any teeth pulled. The lower jaw was moved forward without actually moving the bucky teeth. And now look at his jawline and his cheekbones, right?
Wow, it's absolutely incredible to see the difference. Now, we talked about how this also can help with your sleep.
Yes. So now if we think about the jaw position, if the jaw is further back, what is it doing? It's pinching our airway.
Right.
Right? So we wanted to come forward.
Oh my gosh.
So we want to grow right forward. So we're so obsessed with just straight teeth. Airway orthodontist is still going to straighten your teeth, but we're going to straighten your teeth while also getting the structures in the right way. And the reason I'm using the word structure is when we think of sleep apnea, one form of sleep apnea is called obstructive sleep apnea. Obstruction means there's a structure or function that's in the way of your airway pipe, and that could mean the tongue as well.
Oh, wow.
So if your upper jaw and lower jaw is too small, well, where's your tongue going to go?
Right.
Further back, right?
Oh, wow. It's absolutely fascinating. My mind is boggled by this, and I'm trying to think of my own breathing and my teeth, and I'm like, wait, are my teeth in the right spot? And you also have a case that you worked on with your son as well.
Yeah, so I think that's another slide that I have coming up. I started him early, and this is actually where my whole journey started. When he was 3, he had crowded teeth, so it's from a very superficial point of view, and I get that. I was just curious, why does a 3-year-old have crowded teeth?
Right.
So that's him at age 4, the first picture, where it says age 4.
So you separated his teeth and got those little spaces?
Yeah, I put an expander in to open up his airway, but it wasn't just for the space, it was also for his palate. So think about the roof of the mouth is the base of the nasal cavity. So I didn't cure my son's sleep apnea, but I did help him breathe a lot better.
Okay.
So that's all I wanted, was him to sleep better. And now if you take a look at this as a patient of mine, he came in as a child to me, a child when I first saw him. But look at his bucky teeth. Do you see how they were sticking out? That was
the parents, the upper lip, the bucking teeth for sure.
Major concern. So parents came to me because they were told he has to get teeth pulled, and mom said, you know, absolutely not. Worked on him slowly because boys are a little challenging. And now take a look at his after. Look how we pulled the jaw forward. I did not move his upper lip back.
Wow.
I kept it where it was.
Incredible.
Sleeping better, better posture. So if there's any takeaway from this, I just don't want, I want people to go for second opinions and take a look at before somebody suggests pulling out teeth just for the sake of straighter teeth. Think about how many people you know in your family that have sleep apnea or snore loud. Think about what we can do to help them. That's my only message I really want out there.
I'm going to look into it. I am taking notes. Where can people find you?
Please, I have lots of information. You can find me on Instagram under Dr. Mandeep Johal. I have lots of content on there talking about airway orthodontics, sleep, posture.
Perfect.
And breathing.
Thank you so much for joining us today.
You're very welcome. Thank you for having me.